Hello and good day, everyone. My name is Darlena Birch, MBA, RDN, and most importantly, Public Health Dietitian. Welcome to my YouTube channel, where I talk about U.S. federal nutrition programs, the important role they play in ensuring the health and well-being of all Americans, and how public health dietitians work tirelessly to support these amazing programs. Today, I'm going to discuss public health nutrition, what it is, the role of the public health dietitian, and why it all matters. But before I dive deeper into discussing public health nutrition, let's first set the stage and define public health. Now, I've chosen 3 different definitions from various organizations to help kind of set the stage so that you, the YouTube watcher, can better understand what it means to be working within the world of public health. The American Public Health Association, also known as APHA, defines public health as the promotion and protection of the health of people in the communities where they live, learn, work, and play. Whereas a doctor treats patients who are sick, individuals working in the public health sector aim to prevent people from getting sick or injured in the first place. Now, the CDC Foundation defines public health as the science of protecting and improving the health of people and their communities. This work is achieved by promoting healthy lifestyles, researching disease and injury prevention, and detecting, preventing, and responding to infectious diseases. Now, the third definition I've pulled up is from the Johns Hopkins Bloomberg School of Public Health, and it describes public health by comparing it to the medical field. In the medical field, clinicians treat diseases and injuries one patient at a time, but in public health, we prevent disease and injury. Public health researchers, practitioners, and educators, including dietitians, work with communities and populations. We identify the causes of disease and disability, and we implement large-scale solutions. For example, instead of treating a gunshot wound, we work to identify the causes of gun violence and develop interventions. Instead of treating premature low birth weight babies, we investigate the factors at work and we develop programs to keep babies healthy. And instead of prescribing medication for high blood pressure, we examine the links among obesity, diabetes, and heart disease. Such data is then used to influence policy aimed at reducing all 3 conditions. So essentially, public health as a field aims to improve the overall health of populations through prevention and the implementation of large-scale solutions. So now that I've defined public health, I want to go into the specifics of what public health nutrition is. According to the Academy of Nutrition and Dietetics, aka AND, public health nutrition is the application of nutrition and public health principles to design programs, systems, policies, and environments that aim to improve or maintain the optimal health of populations and targeted groups. Now that I've defined public health and public health nutrition, I want to get into the specifics of what it means to work as a public health dietitian. As a public health dietitian, your work encompasses providing nutrition support to the public, largely through federal programs. For example, dietitians working in the following federal programs are considered public health dietitians: the Special Supplemental Nutrition Program for Women, Infants, and Children, the Supplemental Nutrition Assistance Program, the Child and Adult Care Food Program, the School Breakfast Program, and the National School Lunch Program are all examples of federal nutrition programs that would employ public health dietitians. Now, at the federal level, you can also find public health dietitians working in organizations such as the United States Department of Agriculture, aka USDA, the Department of Health and Human Services, aka HHS, and the Centers for Disease Control and Prevention, aka CDC. By no means was the list I just provided exhaustive. I just wanted to list a few specific examples of programs and organizations that employ dietitians within the public health centers. As it relates to the specific work of public health dietitians, the kind of nutrition support they provide varies. For many of these federal nutrition programs, although they are funded at the federal level through organizations such as USDA, they are often administered at the state level, who then may disperse funds to the local level. One program that follows this model I just mentioned is the WIC program. Remember, I called it the Special Supplemental Nutrition Program for Women, Infants, and Children, but it's more widely known as the WIC program. And this is actually the program that I have worked for the entirety of my career. And so I'm going to use the WIC model specifically to just give you a better understanding of the specific work of public health dietitians within WIC. In WIC, funds are dispersed to state agencies through USDA'S Food and Nutrition Service, who then distributes those funds to the local agencies. And it's at the local level where direct services are provided to WIC participants. So let me describe the kinds of work you may find with public health dietitians depending on the level of where they work within WIC, which is the local, state, and federal level. Now, before I move forward, I do want to clarify that for other programs, they may not operate at these 3 levels, and their setup may look a little bit differently. Because I've worked in WIC, I'm using this specific example, but again, like I said earlier, other programs may operate more at the state level, they may not have a local level, and I'll go into more detail about those other programs I've mentioned in future episodes, so please stay tuned. In WIC, the local level is where participants come into the clinic to get certified into the program before receiving nutrition support, and this nutrition support comes in the form of food benefit issuance, nutrition education, breastfeeding support, and referrals to health and social services. Public health dietitians working at the local level will provide nutrition education to participants and may carry out various other tasks depending on the setup of that specific local agency. Now, if you move to the state level, one of the biggest roles of public health dietitians in WIC is to review the foods provided in the WIC food package. This means that they will look at the nutrition facts panel and compare it to the nutrient requirements outlined in the federal regulations for the program. From there, dietitians will then decide whether or not a particular brand will be included in the WIC food package itself. Now, at the federal level of WIC, public health dietitians work to manage program policies as it relates to nutrition within the program. I personally haven't worked at the federal level, although I have worked at the local and state level of WIC, and so I'm not going to go into too much detail of the federal level because I don't want to misspeak and misrepresent what public health dietitians at this level do for the WIC program. Lastly, I'm going to conclude today's episode by discussing why public health dietitians matter. Ultimately, public health dietitians play a vital role in optimizing public health by helping to ensure that federal nutrition programs provide adequate nutrition support to the larger population. This is also accomplished through the provision of public education on healthy foods and diet, as well as through helping communities increase their access to healthy foods. So how does public health nutrition impact you? If you're among the millions of Americans participating in any of the federal nutrition programs I've just mentioned, then you should have a better understanding of how public health dietitians matter and why public health nutrition is so important. However, I'll discuss each of these federal nutrition programs in more detail in future episodes, so please be sure to stay tuned. If you do not participate in any of the programs I've discussed, then you'll want to stay tuned for my episode on the Dietary Guidelines for Americans, abbreviated DGA's, because the type of nutrition education and advice you receive from healthcare providers, including your doctors, nurses, and dietitians, are all impacted by the DGA's. Thank you for joining me today. If you like what you see, please smash the like button and subscribe to my YouTube channel. And remember, you are your own best advocate. Feed your body well, nourish your soul, nurture your mind, and nutrify your spirit. Remain true to yourself, and never forget that every second forward is another opportunity to be a better version of your past self.